health system is founded on the efforts of the workforce that maintains it. Amid and beyond crises, the health workforce ensures the equitable delivery of health services, especially in rural areas which are often vulnerable to overlapping health issues. Despite this, figures under the status quo suggest that the world is still a far cry away from reaching worker sufficiency in rural settings. Today, I would like to talk about the persistent shortage of rural health workers and its impacts on global health. But first, allow me to introduce myself. I am Justine Reimon Villanueva, a rising senior from the University of the Philippines Rural High School. I serve as editor in chief to our school publication, as well as co founder and research director of MediScholar, a youth organization advocating for health literacy. I arrived at this presentation topic given my recent immersion in rural health research, which I've been pursuing as my capstone project for senior high school. The definition of rural health is straightforward. Rural health refers to the health of individuals residing in rural areas, usually on the basis of population density, remoteness, or economic activity. A little less than half of the world population reside in rural communities. Yet these large proportions are often juxtaposed with pervasive issues in rural healthcare, which is often characterized by both unavailability and inaccessibility. Due to severe underinvestment, rural communities face constant inadequacies in health resources, making it a struggle for providers to sustain operations, develop services, and respond to need. For instance, rural regions in the US are constantly hampered by hospital closures and large mental health service gaps. Meanwhile, pre existing poverty and geographic isolation further hinder residents' abilities to access health services. Given the high rates of poverty in rural areas, the financial and technical burden of transportation and accommodation discourage residents from availing healthcare. Of course, all of this has its negative effects on rural health outcomes, which historically has worse measures of preventable hospitalization and mortality, poor lifestyle factors, increased prevalence and risk of disease, as well as late stage diagnoses. All of these issues attest to how rural communities already carry the brunt of multiple burdens. A competent workforce is necessary to respond to these challenges, but even their sufficiency is not certain. The health workforce consists of workers whose primary intent is to secure and promote health. Represented largely by health professionals, the health workforce is fundamental to the study, diagnosis, treatment, and prevention of disease. Despite their importance, however, the world has and continues to face great deficiencies in the health workforce. A shortage of 15 million health workers was reported in 2020, and researchers still expect a 10 million shortage by 2030. Amid these global deficiencies, where do rural areas stand? Well, the global shortage of health workers is accentuated in far-flung communities, putting more pressure on their already understaffed health systems. As examples, let's take a look at the US and the Philippines. The United States, already a developed country, is expecting large-scale shortages in its nurses and physicians within the next decade. But as early as now, rural areas are experiencing the worst of deficiencies, with two-thirds of all designated shortage areas being rural. While 20% of the US population resides in these rural communities, merely 8% of all physicians and surgeons are deployed in such settings. This leads to large gaps between the rural and urban numbers of health professionals serving the same population sizes. Meanwhile, rural healthcare in developing countries like the Philippines also face great disparities. At present, the Philippines is confronted by a shortage of 190,000 healthcare workers, which translates to a ratio of 2.6 physicians and 8.3 nurses per 10,000 population. This means that around three-fourths of the country's cities and municipalities fail to meet recommended human worker densities. Against the backdrop of these deficiencies, 46% of the Philippine population reside in rural areas, but just 10% of the country's health workforce serves in these areas. This renders two-fifths of the poorest, often rural municipalities, doctorless. The cases of the US and the Philippines are but localized reflections of the global crisis in the rural health workforce. According to the International Labor Organization, even when almost half of the world population come from rural areas, only 23% are ever deployed in these regions. Hence, rural settings make up as high as 7 million out of the 10 million global shortage of health workers. In terms of healthcare coverage, 52% of rural populations worldwide are estimated to be excluded from healthcare due to regional workforce deficiencies. This is almost twice the percentage of urban exclusions for all continents of consideration. All of these figures tell us a story of great disparity, quite literally isolating rural communities from their right to healthcare. The disproportionate workforce shortages experienced by rural areas stem largely from cascading difficulties in attracting funding and retaining health workers. Rural areas, after all, are often situated away from centers of activity, which translates to isolation from friends and family, recreational spaces, and training opportunities. In public policy, the same isolation leads to neglect and stagnating interest among government decision makers and private entities, leading to chronic underinvestment, which in turn lowers salaries, lessens benefits, and reinforces lack of resources and manpower. Health workers who stay are therefore forced to compensate for deficiencies in assistance, leading to heavier workloads and consequently health worker burnouts. Taking all these factors and pairing them with the allure of urban migration, it is no wonder why more and more people are opting out of rural areas. Nevertheless, resolving these issues, while difficult, is not impossible, especially when solutions are multifaceted and collective in their approach. Reinvigorating interest and investment in rural healthcare, for instance, can steer funding in the direction of rural areas. Bolstering rural recruitment and retention should also remain a top priority. Countries must continue to fund the education of future health professionals while attempting to retain existing health workers through proper compensation, sufficient training, and assistance. The exploration of telehealth and other health information technologies may prove useful in temporarily filling in workforce gaps. While continuing to spread awareness regarding the difficulties in rural healthcare remains a fundamental step to calling for action and change. All in all, rural areas already face poorer health outcomes due to great challenges in the availability and accessibility of healthcare. With the shortage of health workers around the world, rural communities shoulder the brunt of the constant maldistribution of human resources, thereby exacerbating pre existing disparities. In overcoming the shortage of rural health workers, it is imperative to rekindle investment, bolster recruitment and retention, explore innovations, and raise awareness toward equitable access for all. In the end, rural populations reserve the right to good health in the hands of competent, sufficient, and well valued healthcare professionals. So let us continue to march onward to reach all communities, no matter how far. Thank you very much for listening. Here are my references. I would like to sincerely thank the GHLC 2024 team for the opportunity to speak and present. I would also like to thank my family and especially our dog Tokyo for their support. Thank you very much.